Good morning, everyone, and thank you so much for the invitation to be here. Tiet Albrecht has followed me, I think, in the last 10 years, trying to get health literacy on the agenda, and we are trying to succeed on that mission. But EU has put us on another mission, the cancer mission, to improve the lives of more than 3 million people by 2030. As we hear from our colleagues here, we are currently going backwards, and we need to change the direction. And Beat the Cancer plan is one of the tools we have to turn the tide. And in the Beat the Cancer plan, cancer literacy, health literacy is mentioned. And what is health literacy, you might ask, because for many people this is a new concept. It's really about the knowledge and motivation and competencies that people have to access, understand, appraise and apply information to make decisions concerning healthcare, disease prevention and health promotion in everyday life, to maintain and promote quality of life during the life course. So you see, it's not enough to just have the knowledge or be aware of cancer. You also need to have the motivation and the competencies to actually act on it. And it's not only about treatment, it's also about prevention, and it's about staying healthy in everyday life. It's not only when you're in touch with the clinical settings. And also, health is not the end goal. Quality of life is the end goal. And I think that's particularly important when we talk about cancer and decisions that have to be made on the cancer journey. We have seen from research that health literacy, or the lack of health literacy, or limited health literacy, has crucial impacts on activities. It's about understanding and interpreting health information from authorities, for example. It's about interacting with health professionals. It's about making and maintaining decisions regarding health. So, for example, go to have a treatment, manage one's own health and self-care, and to navigate health services. We thought we were doing well in Europe. Unfortunately, we are not. We believe in Europe we have good educational systems, we have great healthcare systems, and great societal systems to support us. However, we have seen from the recent study on health literacy that on average, in the study including 17 European countries, that 15% are doing excellent. They are professional consumers, they are professional patients, they will find their way. 40% are doing okay. They might be a bit concerned, but they are doing okay. The problem is that 30%, more than 30% find it problematic, and 13% really do not have the skills. And we see considerable variations in and between countries. So some countries are performing better, some are performing worse. And in some areas, it's worse. We do also see some groups that are not, that are facing even a higher burden, can be ethnic minority groups, elderly, or people with low socioeconomic status. These groups are also coming out in all other statistics, but basically they face the burden of often worse health and poor health and poor economy, and then poor health literacy as well. We have some data from US that says that improving health literacy could prevent nearly 1 million hospital visits and save over 25 billion a year. Because those counties where the populations have a higher health literacy, they get 30% more flu shots. They have more than 25% avoidable hospitalizations, fewer readmissions, and fewer emergency department visits, and also lower costs. So health literacy is big business. It's not only an impact on the individual and their family and the community, it's a societal burden, an avoidable societal burden that we need to face. And some countries have done it already. They have developed strategies, action plans. You have some examples here from Germany and Portugal and Scotland. Norway just launched one last year, where health literacy is made a priority. Austria, for example, has had limiting health literacy as one of their 10 national health goals. And we see a concrete impact when we look across the cancer spectrum here. It's influencing the cancer journey, when you know about your cancer profile, predisposing factors, and what you need and what can enable you to combat it. We have just heard about Ted Albright's work on the National Cancer Control Plans, and I analyzed them a couple of years ago before the corona, and we saw that 5 countries have already included cancer literacy, and I hear now some good information that we will have it also in the new joint action plan. Really, it's about making the match. It's about not only looking at people's skills to deal with the system's complexity, but also that we as systems become much better in tackling and managing people's complexity, and cancer is indeed complex. This is my last slide here. We can do it by looking at the smallest detail of information and communication, how we communicate in plain language, for example, if we make products more easy to use, if we make lower barriers for interaction and with services, do not postpone any plans from the system side, if we enhance the capacity of our workforce to deal with health literacy, and if we study the beliefs and the values of the target groups that we work with. So please be health literacy champions in whatever capacity that you are. Face this challenge, be the change, because cancer literacy matters. Thank you.